I just wanted to jump on and share with you guys a little bit of my dental experience today working in the office on a Saturday. I'm a dental hygienist and I'm also a Burst Senior Ambassador and Burst TV team member. So on Saturdays, I decided to volunteer my time and come in once or twice a month to really help with special needs patients or patients who take a little bit more time during their routine care so that we can focus on these individuals. And today, I had a patient who hadn't been in over 15 years, or he hasn't had local anesthesia in over 15 years for his gum treatments. And the doctor assessed the health history, everything was good, blood pressure was wonderful, and he even had breakfast and something to drink before his procedure. And I guess the anxiety kicked in and he felt really claustrophobic. And those are probably one of the worst patients or difficult patients to treat, because when you lose that sense of control, the anxiety and that overwhelming feeling starts to kick in. So we couldn't do anything to calm him down. He started getting the cold chills. I took a second blood pressure reading and his blood pressure was sky out of the roof. And in these situations and scenarios, we want to make sure that we actually can think fast on our feet to not jeopardize the patient. Don't make them feel like they're an inconvenience. He kept apologizing. He felt terrible, but deep down inside, I felt terrible. And I just told them, I just want to reassure you to make sure that you are okay. Your safety and your comfort comes first. Don't worry about us. Don't worry about the cost of you being in the chair, the materials that we use to prepare for this appointment. This is the reason why we are here, is for you, for your care. I did not dismiss him from the chair until he felt coherent enough to actually get up. We did not allow him to drive. We had his niece, who was with him, thankfully call a family member to come pick him up. We left his car at the office and I continued my work day. Before I left, I did make sure that I did a post-op call to see how he was doing, and that little gesture made him feel so much more comfortable. He was doing great. Sometimes too, patients who experience too much local anesthetic will kind of tighten up these muscles in their jawline and they end up getting trismus. Trismus is lockjaw when those muscles spasm or if you have too much anesthetic in those areas. So post-op instructions are really important. I iced him down before he left. I sent him home with that ice pack and then had him continue to do it at home too. And overall, a stressful day turned out to be a wonderful day because the patient wasn't upset. He was very blessed and thankful that we took his needs into our priority care, and he rescheduled for his next visit. So I am going to make sure that we only numb half of the mouth at the time and possibly do Oracix instead of local anesthesia, just to kind of get him more familiar and comfortable with being back in the office. So I hope this little reflection helps you guys. I don't know if you guys ever experienced something like a medical emergency in the dental office, but I would love to hear more scenarios or how you guys reacted and handled it.